move forward. So this first slide is one I've used in my career, and it really, for me, just helps kind of frame for folks that might not be as familiar with HR and recruitment so that they know what we mean when we say workforce planning. The key takeaway here, and the key takeaway for all of us is, in today's climate, to go to finance with a project, it's really important that you go to them with the concept, a project, an initiative that's tied to a key strategy in the organization. You really need to be able to prove that you understand how that project or that initiative will impact the business in a positive way. I know when I started early in my career, I would have, I think, probably some pretty good ideas, and looking back, some were better than others, but, I naively was not able to tie them to a business strategy, and I really wouldn't understand why everybody didn't think my idea was as great as I thought it was. So really important that you're able to tie your ideas, your thoughts, your strategies, something that the business is trying to achieve. And so just keeping that in mind, again, as you begin to understand what the strategic imperatives are in the short and long term, you can start identifying your critical positions, the ones that you want to focus your time on. And then you can begin this linear process of assessing who in your current workforce who might be able to help you meet your recruitment needs, where gaps are, and sort of where recruitment and workforce planning really play into the rest of HR and the plans that they're making to also fill any talent gaps. So it's really an integrated approach, and recruitment and workforce planning play one critical part of that approach. Okay. Let's shift now talking about how do you identify a critical position. And I get asked this question a lot. And so I put these ideas together so that you can start thinking about what your critical positions might be within your organization. And put revenue first, because I think in this environment, revenue is a hot topic and a key topic in every healthcare provider, even in the nonprofit arena. And we still need to be able to sustain business operations. So revenue and looking for those positions that either are currently or will be continuing to drive revenue attainment is really important. And those might be, sort of one individual, or it might be a large group of individuals. How do you find this out? Well, it's really important that you have a good dialogue with finance. Talk to them about where they see the growth in the business going, and then identify the ones that are top of mind for them. What business units might be top of mind, what service lines might be top of mind, where they're planning on going with the business going forward, kinds of things that you want to know. I put patient experience second because, as I'm sure you know very well, the patient experience is being reported publicly now. And so a couple of things are coming into play. Information about people's perception of your service in the open marketplace. Plus, you've got a whole new customer base that you can draw from now. So you want to be able to make sure that when the reviews are out there, you've got people who are newly insured that you'd like to attract to your organization for care. You make sure that the patient experience that everyone is receiving is positive. So for those that really play into that, those might be those frontline positions. You're going to have to make some choices in your organization about what those positions might be. Indicators, the ones that you look at, looking for positive and negative trends. A couple things that I would encourage you, in addition, to really pay close attention to as our population gets older is an FTE and pending retirements. Because I think we've been really lucky in the last few years, at least I know in the organizations that I've worked in and worked with, we have a lot of people who held off of retirement because they either were concerned that their 401k or 403b no longer was funded the way that it used to be because of market declines, or the spouse that got laid off. So people were really, really holding back and working longer. And while that trend will probably continue, we'll see people maybe pulling back. They want to work the kinds of hours that they used to. Or they, again, just decide that it's time to retire. So you want to keep an eye on those trends and make sure that you're taking those things into consideration as you're putting your staffing plans together. Things that I think are really challenging are shortage areas as well as these emerging roles. Shortage areas where we know we have key shortages in leadership, like our chief nursing officers, where we just don't, we really don't have enough talent in the marketplace and everybody's competing for those folks. Or roles where we just didn't have them 2 years ago or 3 years ago, those emerging roles where there's really no pipeline even to recruit from. There are things that you might want to identify in your top 10, critical positions, or however many you decide to target list. I'm going to shift from thinking about how we identify our critical positions to thinking about how do we build a multi-workforce workforce plan. And I divided this into two kind of thought processes. Again, I'm going to go through the first slide a little bit slower, and then when we move to the next one, you'll already have hopefully an understanding of the key concepts. But think about a current service line, because in most organizations these days, you've got two things going on. You've got the current sustaining of operations, and you've got all of the plans that we're making to expand our service line. So you want to look at revenue. Is there a look back that makes sense in terms of the revenue that you've had in the past, and what's the projection for that? Is it declining or is it growing? What's it been like, and declining, or is it growing? What are the HR indicators? And we just talked about those on the previous slides. Just really taking a look at, are trending in a positive way or a negative way, and what's the rate of change for those indicators. Really important. Are you able to get talent in the door, and what timeline where are you able to get that? Are your jobs being accepted? What's your recruitment brand looking like? How's that trending? And what's the performance of the new hires that you have? Are they staying? Are they coming and leaving? And then last but not least, what's the mix of staff that you have to use? Can you use FTEs? Are you able to get them in the door, or do you have to use a mix of travelers, temps, and floats? And the average starting point, you adjust by projected growth and decline. So that might sound a little bit confusing. So you take your average projected census staffing ratios and adjust it by whether or not your financial leaders and leadership say that business is growing by X percent, that's our projection, or business is declining by X percent. I hope that makes sense to everyone. Let's look at an emerging service line. It's sort of the same concepts that we talked about in a current service line. The only difference is you might have historical data to use. That doesn't mean that you can't do a multi-year workforce plan or projection of the recruitment needs. You may have to look into the market to similar businesses. You look outside of your market in businesses where it's something maybe is happening ahead of the curve in a different market. And then, again, you take the same kinds of considerations that you did with a current service line and project the number of patients per day, and then what's the staffing ratio needed to support that kind of patient load. And then you'll look at your HR indicators. You may have a solid recruitment indicators. You'll have to kind of do some guesstimating on those. And then if you don't have a recruitment pipeline, because this is such an emerging line that you just don't have the talent in the marketplace, and we'll talk about the external scan in a second, and how to make that a weighting into this process, you have to try to find other kinds of staff that you can bring in. So again, the factors are very similar with some differences. And again, don't be afraid to look at other businesses of a similar nature and try to draw some conclusions from what they're doing. Okay, let's shift our focus to we've talked about looking at our internal staff and what that makeup looks like in terms of our plan. And those folks, can we develop them? Can we grow them? Can we move them from maybe acute care to a wellness setting with some training? We know what we've got to draw from internally, so we need to look into the marketplace to say, okay, so we know we've got internally, how are we going to fill those gaps? And what's the talent pipeline available to me to do that? A couple of different ways you may want to look at it. First of all, you may want to take a look at new graduate pipelines. Now, the news about new graduate pipelines, I do think that many educators, the for-profit and the not-for-profit, have gotten wind of that there's a lot of opportunity in the healthcare marketplace. So hopefully they've been reaching out to you and asking you what you need in terms terms of workforce. But the great thing about the fact that they're so engaged is they've started doing a lot of what I'll call the heavy lifting for us, which is sort of tracking their expected graduation rates from different programs. In some cases, I'm finding they even know sort of where their students end up. Do they end up staying in the general catchment area? Do they move on to other physical locations, so that you can get a sense for, if there's a class of 20, how many do you think I can expect to recruit into my organization? And that'll help you know, again, if you've got holes and gaps in talent, you'll know, can you get enough new grads to help fill those holes? Look at the current practicing individuals in the area. This information, again, can be available through licensing organizations and other organizations who track practicing licensing individuals. If you can, you want to take a look at their age and service demographics, because you really want to think about, okay, is this an older population of workers, and maybe they're all going to retire, so that pool's going to dry up? Or is it a group of workers that I can expect to be available in the marketplace for some time to come? And last but not least, once you kind of know what your new grad pipeline looks like and your current practicing pipeline looks like, you want to start thinking about, okay, what's the equation in terms of my competition for talent? Am I getting most of the talent in the area because my recruitment brand is so great and I have such a great reputation as a place to work? Or is it the opposite? And it'll help you kind of do some analysis and thinking about, is there a further gap that I need to fill through some other kind of plan that I'm going to ask for funding for? Because it's all about getting a picture of the lay of the land, so you know what you need to do in order to fill the gap. Is this something that I'm going to need to put a plan together and gain funding for? So here's kind of how it all looks when you put it all together. You'll look at your internal demand, your external supply, and you'll come up with either your shortfall or surplus. So your internal demand, your external supply, and that internal supply too that may be looking to develop in their career, move up a career ladder. And again, putting that all together is what your shortfall and surplus will be. Okay, let's shift gears just a little bit, because once you've got this magic analysis done and you have a sense for, here's my top 10 jobs, I know what the supply looks like internally and externally, I know what I think my shortfall is going to be. Now I need to go to finance or whoever makes financial decisions in my company about funding projects and ask them to support the plan that I've put together to solve my shortfall. So I really wanted to do in this section is not give you, Finance 101, but just kind of give you some ideas and some purview into sort of how financial people think, what their roles and responsibilities are, and then some terms so that you kind of know where they're coming from when you're meeting with them to your great idea. So financial people have, a fiduciary responsibility and a fiscal responsibility to share resources effectively, as does everyone in a company. But it is their, key goal and their key role and part of their responsibility to make sure that the resources that they have at their disposal for the organization are used in the best and most effective way. So they've got a couple of different options of what they could do with money or resources. Is they could invest in the financial markets, stocks, bonds, whatever financial instruments are available to them that they want to invest in. The option is they can invest in the organization. So that might be a project that they finance. Maybe it's a new building. Maybe it's buying a new piece of machinery. Maybe it's, enhancing a service line. And so their choices are really sort of those two things. And with that, they have to think about sort of what is the best return resources to have. Can I make more money in the financial markets, give us more money to do more things? Or if I invest in this new piece of equipment, bring more patients, more customers, and then I'll have a better return on the money for using it that way. And it's a fine balance that they're having here. They need to consider the cost of capital, and need to also consider the risk and return on investments externally. So they're weighing risk and return and the cost of capital in making their decisions. So in many cases, they're thinking about cash flow, what's the return. Now, the challenge, I think, in going to finance with our projects is, in many cases, they don't really have a cash flow. They might have a cost savings. So we're going to talk about that a little bit and how you can make the case by showing them the ability to save dollars through the projects that you might be bringing forward. Terms that I want you to know, because again, I said this is not Finance 101, but these are some key terms that I want to try to make sure that you understand and can apply to discussions that have. And the first one, as I mentioned earlier, is lost opportunity. So what happens if we do nothing? Is there a revenue impact if we don't have, nurse at the bedside, or we have that laboratory scientist in the laboratory, processing tests? Well, of course, there's an implication to that. And so you want to be able to try to find a way to quantify that opportunity if we don't recruit and we don't get that nurse at the bedside, or we don't recruit that medical lab technician because we didn't fund a project. What's the cost of that going to be? There's, it's not a complete scientific way of doing it, but there's certainly a way to go about doing it. We're going to walk through that in the case study with high quality healthcare. About cash flow, a lot of our projects, I would say 99.9% of the projects that HR or recruitment will bring forward do not use cash flow. Not designed to, but they might bring savings. So again, even though finance is looking at projects, looking at the cash flow that they might produce or the rate of return that they might produce, we're looking at ways to save the organization money, which again frees up resources to do things that produce cash flow. So there's a couple ways that a finance person might evaluate a project. If you've ever had a finance class, you probably saw this very long explanation of how it all happens with cash flows and all kinds of things. I don't think that for us we need to be that scientific, but we do kind of need to know whether our organization uses the net present value method or the internal rate of return method. Most organizations that I see do use net present value. So what they're trying to do is say, will we lose money by doing this? Or will it be budget neutral, or will we make money? And then they have two projects that they're evaluating. They want to evaluate which will have the biggest financial return. So we're talking about how we take a HR project and being compared to a project that could produce cash flow, and still make the case for why our project might be the one that they want to select over another project. We all know we're competing for dollars now, probably like never before. Okay, just some quick rules of financial investment. Take projects to finance that will give you some sort of cost-saving opportunity. Also know that when finance is choosing between two projects, they're going to pick the one with the highest return. And in our case, there won't be a return, but our cost savings opportunities might actually be better than the rate of return on another project. So we just kind of need to get ourselves into that mindset for these discussions. Okay, other things that you want to consider when you're evaluating your project and getting ready for your meeting with finance. There are two kinds of costs that they're probably going to ask you about. There's direct costs and there's indirect costs. When you do a project or have a program, sometimes you're the only person, the only cost center who's being charged for that program. In a lot of cases, let's take, I think a good example is, let's say we want to buy an applicant tracking system. My team, if I'm the recruitment manager, will be involved in finding vendors, reviewing the software, looking at processes, deciding which one we like the best. Once we do that, or even as we're doing that, We may want help from IT, so there's cost associated in bringing in the IT person, an indirect cost. The costs associated with the program, but they're not part of the actual project. So hopefully that makes sense. We might bring a contract person in. We may need to bring purchasing in. Their time will all be allocated to the cost of this project and will be considered against other projects that are being used for consideration. So just kind of a sense for, what's a direct cost, what's an indirect cost. When you're putting the cost of your project together, make sure you don't forget all the other costs that are indirect around you, because they will count into the cost and take away from any kinds of cost savings that might be enjoying. I just want to make sure you think about that. And then when you're thinking about the actual cost savings, there's lots of things that you can consider. For example, if you do a new recruitment brand with a big pipeline, will be able to recruit more quickly, which means you don't lose productivity in the area that you're recruiting for. There's lots of things to think of as it relates to cost savings. About all the things that you think you're going to impact, and make sure you try to quantify those so that you can add those to your value proposition for cost savings. Okay, just giving you a sense again of the difference between a finance person may see as a typical investment and a HR project. Because as you know, in many cases, we're considered a venture, right? So within their mindset, they've got startup costs, and we call those sunk costs. Costs we're not going to recover whether we do the project or not. We've got direct and indirect costs that we just talked about. We've got sales and marketing costs. So if we buy that new fancy open MRI, we want to make sure that patients know that it's out there. So there'll be some marketing and sales costs. In your project, there may also be marketing costs if you need to spread the word about this new program. Maybe there's a recruitment marketing cost or an internal marketing cost about a fabulous new opportunity. So don't miss the marketing costs. There may be depreciation on investment. And you might be thinking, so what kind of depreciation would there be on my investments? There may be depreciation on software. There may be depreciation if you buy equipment for a particular training program. All things can be taken into consideration, and you don't have to be a master of calculating depreciation. You can certainly work with your finance person to help them help you figure out how you might want to allocate that in your review of the project. And not least, there's cash flow on a typical project, and there's outcomes, returns, and this impact of what you're doing, which typically, again, relates to cost savings. Okay, so that's a fast 30 minutes of concepts and thinking through this process of going to your organization and asking for funding. So now I'm going to hopefully bring it all together by walking through an actual example from a real organization who did just what we've been talking about for about the last 30 minutes. We pretend by calling them high-quality healthcare. They actually are high-quality healthcare. We're protecting the innocent and not so innocent here in this discussion. But let me give you a little background on high-quality healthcare. It's a large integrated healthcare organization with multiple service lines, and they're growing, which, of course, in any environment is great news. Significant revenue being derived from what they had as a reference lab. So they were serving lots of patients in the general area and processing a lot of tests for other organizations. So this was a great revenue stream for them. This test volume was projected to continue to grow. So things are going well, and things are looking like they're going to continue to go well from a business perspective. What's not going so well is the fact that there was a shrinking labor pool to perform the work and increased demand from these workers across a number of industries, including biotechnology, who basically hired for the same degree. So while high-quality healthcare is growing, the industry as a whole is also growing, and demand for these workers is very high. So if you think about the fact that it puts the business plan in jeopardy. This is a high priority for finance, but they might not even be aware they have an issue because they're excited about the business growth and sometimes not thinking about the fact of will we have talent to actually meet our mission here. Let's take a look at it from two perspectives. Let's think about it from the business person's perspective and then what we need to do, and I called it HR, but it's probably recruitment, who will be charged with finding these individuals. So this is if we don't have individuals to do this work, and this is the lost opportunity cost that I was alluding to earlier, we'll have increased time to result, satisfaction and outcomes will not be what we had hoped that they'd be. Our customers that we've been able to attract into the organization will not probably work with us if we can't meet on the results and the timeframes that we've said that we would deliver on, which means we're going to lose revenue and our costs are going to increase because we're probably going to have temporary labor or more expensive travel labor come in and fill in where we don't have full-time equivalents. So when we think about what are the issues for HR, we're going to have a longer time to fill. We'll have increased recruitment costs. We'll increase salaries because when there's a shortage, of course, the cost of the item goes up or the cost of the labor goes up. We'll probably have overtime charges that we wouldn't have had we had a full book of employees. And because of overwork, we may have increased employee satisfaction and engagement. So it's not a pretty picture. I like this slide because you can use this kind of format to talk to finance about the implications of lost opportunity in a qualitative way without actually putting, dollars and cents to it, especially if you don't think you can get your hands on it. But I challenge you to do that. And I'll show you what this organization did in a minute. But the question will become, okay, so I know I've got problems in my reference lab, but I've also got problems in this other service line, and they're asking me for pieces of equipment. I've only got so many dollars, and I'm going to decide which project that I'm going to undertake. They can only fund one. The question becomes, should we spend dollars to grow? So this is maybe the proposal that you put forward. We find our talent in the local market, so we want to recruit from out of state. Or the other proposal is we grow our own and we pay the dollars to create an education program and to these individuals ourselves. These are the two options that this company brought forward. I had a pretty good understanding of where they were going from a hiring need perspective. So if you look at this slide, they've projected out to 2021 what their hiring needs are going to be. And so let me just walk this through really quickly. The second line and the third line are negative numbers because that's actually taking away from what the hiring needs are going to be. And those are described as the top line. And the shortfall or the plus is the positive number. So that's the number that they're going to need to hit each year in order to sustain operations and meet revenue targets that they've been given by finance. And I'll give you a little bit more detail at the bottom here, just so that you can kind of get a sense for the hiring need and how it was calculated. And then we're going to talk about revenue attainment shortly. The current revenue, it's $200,000 a worker. They've got 100 workers currently, and you can see the bottom number is who they need to hire, or the number that they need to hire in the marketplace. So hopefully it makes sense to you. As I mentioned, they've got two options. They can grow their own, or they can recruit from out of state. So kind of the detail of what costs would be allocated for each project. Project is, I've decided I'm going to grow my own. I think I can get 10 people in the local market. See how it's here? I had the second line, so that's where that came from. So shortfall, and some surplus, so I'm going to do a cohort of 10. I've got staff salaries, which is the percent of the time the staff members are allocated to support the program. The cost I'm incurring is the cost of the tuition because the employees, so I'm going to give them tuition assistance. I've got the participant salaries of current employees who I'm going to have to take out of their current role and put training, but I still need to pay their salary while they're in training. Those are the costs for Project A. Project B is if I recruit from out of state, these are the costs I'm going to incur. Recruitment out of the area, salaries to actually do the recruitment, candidate travel to bring the candidates in for interviews. Probably going to have to do some kind of sign-on bonus because the market is just that competitive. We will bring in employees, and then we'll have relocation costs. And you look at Project A, we don't have orientation costs, so the cost savings, because they're already employees, so they're already oriented. So these are our two options. Now let's compare them side by side from a cost perspective. Education program cost is $100,000 a year. My staff salaries are $50,000 a year. Cost of tuition $20,000, and salary augmentation to pay them while they're off of their work, it's $3,000, which brings me to $210,000 if I do this in-house. Outside of state, my recruitment marketing is $20,000, staff salary is $20,000, candidate travel $10,000, candidate on $100,000, orientation costs are $100,000, and relocation or $1,000, and relocation is $100,000. So if you're thinking this way before you go to finance, you make a pretty good case for why you do one or the other because you've done the analysis of what each program is going to cost. So the best way to go about this, at least short term, is to do an education program and do this in-house with an education service provider. So now about how you're going to project cost savings. So all startup costs, your costs for the program, and then things that you're going to save as a result of doing this project. Take on the A as opposed to Project B, you're going to save on recruitment because they're already employees. You're going to save on orientation because they're already employees. So when you add all these things together, that will get you to part of your estimated cost savings. Look at it all together. You look at costs. You look at cost savings because you're saving money over recruitment, right? So that $50,000 is the difference between Project A and Project B on an annual basis. It goes because the need goes up each year. And then there's lost revenue costs. So remember we're talking about the test volume and the patient experience. They're actually able to put a dollar figure to what it costs, what each were brought in terms of revenue attainment. And so that's where this number came from. I mean, this is a pretty impressive number. And so, again, this may not be a perfect number, but it's a conversation starter with finance for you to say, look, I took these things into consideration. And, you can debate what this real number actually might be in their minds. So that is sort of my approach to this linear process of knowing what my needs are, what my options are. I think about the cost of those options and how I bring those forward. And I did talk to you about it being a linear process. But in other cases in this environment, as we know, the ground is sort of shifting around us. It's not necessarily what's true today, it's not necessarily true tomorrow. So it really is sort of an ongoing process of every year, in my view, at least every year, looking at that process of doing an internal scan, the external scan, what solutions you might want to consider, thinking about what those costs are of those solutions, thinking about the cost implications or cost savings of those solutions, and reviewing all the implications as you think about how you want to go about solving the problems of finding, recruiting workers into your organization. I turn it back over to Stephanie for questions.
Before we move into Q&A, please take a moment to note the program ID for today's webinar, 22290. You will need to reference this number when you apply for your recertification credit. This will also be available on the certificate of completion you will receive next week. Now, let's get on to questions. The first question that came in was, can you cover the in more detail flow versus cost savings?
Sure. So let's go back to We'll just talk about cash flow. Cash flow, is derived from a number of different things, from profitability, and so generally a finance person will look at if we have a certain service line, how much cost are we incurring to offer that service? What are we receiving for offering that service? And what's the surplus? And the surplus is cash flow. And of course, it ebbs and flows every financial period. The cost savings, and again, we don't really have opportunity to create cash flow in HR. But as I mentioned earlier, we can really create cost savings by wisely stewarding the resources that we have. And I'm sure that, we're mainly recruitment professionals, but it's looking at the best way to utilize resources, picking the best recruitment source, which is, of course, Healthy Careers, picking the best recruitment branding strategy, and by doing so, you generate cost savings by using your resources with the most effective vendor, the most effective process. In that way, you save dollars. So I answered your question, but if I didn't, let me know.
I don't see any additional questions coming in yet. So if there are any questions before we end today's webinar, please enter them now in the chat field. For a few of those to come in, I'm going to open a poll quick. I know we covered quite a few details in today's presentation, and we're interested to know if you would like us to do a follow-up session to cover any of the content in more detail. And of you that are looking for copies of the presentation deck, I'm going to put that in the chat field for a URL that you can download them now. There will also be included in an email that will go out next week, which have your certificate of completion and access to the recording online as well. I'm not seeing any additional questions come in. We've got a minute, so Jan and I will stay on the line in case any may be addressed in the next few minutes. Other than that, as I mentioned, a copy of the webinar will be available next week. Interested in learning more about Healthy Careers and our full site of Suite Healthcare Sourcing Solutions, you can contact us at info@healthycareers.com. The email that goes out next week will have Jan's contact information as well if anybody would like to follow up with her directly.
Thank you, and I did want to let everyone know that I'm more than happy to answer any questions that you have. I know this was a lot of information to take in. So if you find yourself trying to apply these different tools and questions, please don't hesitate to reach out to Steph or myself. And again, I'm happy to help in any way.
Okay, we did have a question just come in. Two options, grow in-house or external recruitment. Have you factored the cost of replacing the positions of the employees that you promoted from within?
Absolutely. Yes, and I'm sorry I missed that. I tried to keep it really simple, but yes, I think, if you are using current employees and that's going to leave a vacancy, you would definitely include that in Project A in some other plan. Your question, but if I didn't, please let me know.
If he comes back with a follow-up, another one came in. How do you determine the potential value, revenue, an employee?
So this case, and I think in a lot of cases, you can look at the total revenue for that service line or that job classification and, factor out all of the costs in operating that entity and then divide what's left, divide cash flow by the number of employees. That's how they did it in this particular organization. And again, some employees may be more productive than others. I mean, it's not an exact science, but in this company, they felt that was good enough and met their needs.
I guess a follow-up to that earlier question about factoring the cost of replacing employees or promoted. Would you actually add project costs on Project A?
I probably would not at this point in time because it's an event that's going to happen in the future. And you'd have turnover and recruitment costs in a different plan. So while I'm thinking about, okay, these are two projects that I'm proposing to solve this problem, I have had turnover anyway. So I personally would probably put it in my overall recruitment plan. I mean, you could. I mean, there's no, again, I hate to be nebulous. I mean, there's no really right or wrong way. For me, I'd put it in my general recruitment costs.
Okay. Looks like that is our last question. One more minute just to see if any more come in. And thanks everybody who has joined us, and have a great weekend. Oh, follow-up, Jan.
Oh, great.
So you're just saying that by borrowing from Peter, so to speak, that it is actually in addition to your addition.
Yeah, you could certainly look at it that way. And you're right. I mean, you are sort of taking one set of employees to, I mean, you could argue the philosophy of, you're taking this set of employees, you're going to have to replace them, and that would be, an organizational cost. Or you could also argue that by doing this, you create a really nice, employee experience, and it helps with your engagement and reduces your turnover. And that's sort of where things sometimes get a little, have some back and forth.
And at the end of the day, probably pretty equal cost for Project A and Project B. He says thank you for your response.
Absolutely. My pleasure.
I'll call for questions. Okay, it looks like everybody is in the process of signing off. So, everybody, and we hope you join us next time.
Take care. Have a great weekend.
This is today's call. You may now disconnect.